Imagine a solution to knee arthritis that doesn't involve popping pills or going under the knife. A groundbreaking study suggests that simply adjusting your walking style could provide significant relief and even slow down the degeneration of knee cartilage. But here's where it gets controversial. Could such a simple tweak really compete with traditional medical treatments? Arthritis is a debilitating condition that affects nearly 25% of adults over 40, making it one of the leading causes of disability. Osteoarthritis, the most common form, wears away the cartilage that cushions our joints. And until now, managing the pain has been the primary focus, often through medications or, in severe cases, joint replacements. However, researchers are exploring a novel approach, gait retraining. By making subtle adjustments to the angle of the foot while walking, participants in a year-long randomized controlled trial experienced pain relief comparable to that from medication. More impressively, these participants also showed less degradation of knee cartilage compared to those receiving a placebo treatment. The findings, published in the Lancet Rheumatology and led by Scott Ulrich from the University of Utah's John and Marcia Price College of Engineering, come from the first placebo-controlled study to validate the effectiveness of a biomechanical intervention for osteoarthritis. We've known that higher loads on the knee can speed up the progression of osteoarthritis, and that altering the foot angle can reduce this load, explains Ulrich, an assistant professor of mechanical engineering. The concept isn't new, but this is the first time we've shown it works in a rigorous placebo-controlled study. The study focused on patients with mild to moderate osteoarthritis in the medial compartment of the knee, the inner part that typically bears more weight. The ideal foot angle for reducing load varies from person to person, depending on their natural gait and how it changes with the new walking pattern. Previous trials used a one-size-fits-all approach, which didn't always reduce joint loading and sometimes even increased it, Ulrich notes. Our personalized method ensured that each participant adopted a walking pattern that maximally reduced their knee load, contributing to the positive outcomes we observed. During the initial visits, participants underwent MRI scans and walked on a pressure-sensitive treadmill while motion capture cameras recorded their gait. This helped researchers determine whether turning the toes inward or outward, and by how many degrees, 5 or 10, would best reduce knee load. Participants who couldn't benefit from any foot angle changes were excluded, a step that may explain why previous studies had mixed results. Of the 68 participants, half were assigned to a sham treatment group, receiving foot angles identical to their natural gait to control for the placebo effect. The other half received the optimal foot angle adjustment. Both groups attended 6 weekly training sessions where biofeedback vibrations from a device on their shin helped them maintain the prescribed foot angle while walking on a treadmill. After the training, participants were encouraged to practice their new gait for at least 20 minutes daily until it felt natural. After a year, all participants reported their knee pain levels and had a follow-up MRI. The intervention group reported a pain reduction similar to that achieved with over-the-counter pain relievers like ibuprofen or even stronger narcotics like oxycodone. The MRIs also showed a slower degradation of cartilage markers in the intervention group, a promising sign. The best part is that this intervention is something you can do yourself without relying on drugs or devices, one participant shared. It's become a natural part of my life, and I'm thrilled with the results. For many, especially those in their 30s, 40s, or 50s, this intervention could bridge a critical gap in pain management before joint replacement becomes necessary. However, before it can be widely adopted, the gait retraining process needs to be simplified. Currently, the motion capture technology used is expensive and time-consuming, but researchers are developing mobile solutions such as smartphone apps and smart shoes to make the intervention more accessible. We're working on technology that can personalize and deliver this intervention in a clinical setting, making it easier for people to adopt and maintain, Ulrich says. While this study opens exciting possibilities, further research is needed to confirm its long-term benefits and ensure it can be effectively implemented in clinical settings. What do you think? Could this simple adjustment to your walking style really make a difference in managing knee arthritis? Or do you believe traditional methods are still the way to go? Share your thoughts in the comments.